John Mendoza, welcome to 1+1.
Thanks, Joan.
You've had a pretty diverse career, although it's been pretty much in public health. In the time that you resigned as the chair of the federal government's National Advisory Council on Mental Health in 2010, you were saying at the time that there was huge neglect in that area. Less than a year later, the budget came out and I believe there was about $2.2 billion slated for mental health over 5 years. Are we in a better place today in terms of Australia's mental health policy?
Well, look, there's a lot of spin associated with that $2.2 billion.
Understood.
The AMA, for what it's worth, had an audit done by Deloitte Access Economics, and they actually found that there was really only $650 million or thereabouts of new money. There was a lot of redirected money, rebadged money, so money that had been previously announced, if you like, that was bundled into that $2.2 billion.
So $650 million of new money over a certain
over 5 years.
Over 5 years. That's a lot less than $2.2 billion.
Absolutely. And in real terms, what that means is that the proportion of funding in a health budget going to mental health is actually declining. So when the Howard government left office, we were spending, collectively, this is all state, territory and federal government together, collectively we were spending about 8%, bit over 8% of health budget on mental health. We're now down around 7%. Now that doesn't sound like a big move, but when you're talking about a health expenditure nationally of $120 billion a year, it actually matters a lot, particularly when you've got services that are in crisis.
So where do you see today the key crisis points in mental health being?
Well, Jane, what we've really got is a bit of a shambolic, arcane system. You can go to Orange in New South Wales or Toowoomba in Queensland or Charterstown, a number of cities in Australia where there are still 2,000 people who are in residential institutional care. Now, Australians were told in 1992 these institutions are closing. And we've all heard about deinstitutionalisation. Well, we still have people in these psychiatric standalone institutions who have been there for up to 40 years, whose rights have been completely ignored by the state, who are simply invisible to the rest of the community.
2,000 people?
That's right. The point I'm making is that this is a relic of the 19th century model of care, and we still have it in the 21st century.
But what happens to those people if they are not in those institutions?
Okay, the vast majority of them can comfortably be supported in community care systems.
Because their conditions aren't that serious or
stable.
Dangerous?
They're often stable conditions. Yes, they do have needs for, in some cases, 24/7 support. In other cases, we've seen people who have moved out of these institutions, and in Queensland there's been a program that the Beattie government began and Anna Bligh has continued, of moving about 200 people out of Bailey Henderson in Toowoomba into community. And the only thing that's prevented that is the investment in the community services. So there's nothing about the condition or they're a danger to others or anything like that. These are people who have stable condition who will do better both in terms of their clinical conditions as well as they'll actually start to recover in terms of their social interactions with people. They'll start to actually engage in the daily life of the community in a much greater extent.
What about people with mental illnesses who are in prison in the criminal justice system?
Yeah. Look, it's often been written about. I think Chris Public, to his credit as Privacy Commissioner, really brought attention to this in New South Wales, that we had chronic over-representation of people in our prison systems with mental health problems. And in fact, we'd moved from closing psychiatric institutions to basically warehousing these folk in our prisons. And we've seen prison populations grow dramatically in Australia in the last 2 decades.
Because of people with mental illnesses being in them? In
part, absolutely in part. Sad to say that in some jurisdictions, New South Wales being one of them, certainly you can be assured that in prison you'll get access to mental health services. When you're outside of prison, you have much less chance of accessing those public mental health services.
There's been a lot of attention on early psychosis prevention and intervention. Why is it so important to get that early intervention, particularly for young people?
The evidence is extremely strong in terms of early intervention for people in the early adulthood years. Now, these are the years when mental illnesses first come through. It's not in later years, not in middle years, not in childhood per se, but very much so in the early adulthood. And in about 5 years, we will actually have the world's largest integrated service system for young people. And that will deliver enormous benefits to the Australian community. We will not see young people developing mental health problems and not seeing care until they're in their 30s or in their 40s, by which time they've lost employment, they've lost educational opportunities, they've generally destroyed a whole lot of the relationships around them because they're very difficult people to live and work with. Instead, we will get earlier treatment, ameliorate these conditions to a very large extent.
There's been good news if you listen to what the politicians say in terms of the suicide numbers in Australia coming down over the years. Suicide is still reported as no suspicious circumstances. It's almost as if people are still very much afraid to describe something as a suicide.
Indeed, unless it's a person of somewhat public profile. We saw Diana Bliss's tragic death recently in Western Australia, reported widely and reported as a suicide. But the bulk of the suicide coverage that I saw in WA, I was in WA at the time, was commendable because it focused on what were the warning signs, what were the sort of underlying factors that were leading to a situation where Diana, from all the reports, had a treatment-resistant depression, and that does occur. But importantly, the media focus in WA was very much on how, as a community, can we do better.
Finally, in February, when Kevin Rudd was about to challenge Julia Gillard for the leadership, you stated publicly that Mr. Rudd was not fit for office and that you would leave the country if he was returned. You've resigned.
Leave the country was in jest.
You clearly like to make a public stand. You like to have your position publicly known. Is it perhaps too emotional a condition to have?
Maybe.
Why stick your neck out? That's what I'm saying.
Sure. Look, there was a number of people at the time starting to reveal what it was about the Rudd premiership that was really problematic. I experienced that in terms of trying to provide cogent advice to the government in terms of where its investments in mental health could deliver the best for the community. Now, I only spoke up when some of the real story behind his removal started to become public. I certainly wanted to put my view on the record at the time when there was a possibility that he would be returned to the Prime Ministership, that this would not be in the country's best interests.
John Mendoza, many thanks for joining us on 1+1.
Thanks, Joan.